Welcome back, everyone. We are live in Studio 61, and we are talking COVID-19 in Connecticut. With us once again, Dr. Hussain from Trinity Health of New England. Doctor, I know you've been back in the studio before. A first time for me throughout this whole pandemic. It is nice to see you in person once again. I always learn something new when you're here. And let's just jump right into it. A lot of talk right now about a new report involving COVID boosters. What does that picture look like? What should a family know? Kind of where do you stand on that?
Sure. Great to see you, Keith. So in terms of boosters, let's review who is eligible for the first booster. If it's been 5 months or more since you received your Pfizer or Moderna vaccine, the second dose, then you're now eligible to get the first booster. Second booster is those people who are age 50 and above, or if you're 12 and above with an immunocompromising condition, then you're eligible for the second booster. But the basic premise here is let's make sure that you're up to date with vaccinations and you have enough protection against all these new variants.
It almost makes your head spin when we talk about the fact that cases are on the rise in some places. What do we need to be thinking about there? I mean, we are talking this season about how families can get into museums across Connecticut for free. We're encouraging people to do that. I suspect there are ways to do these types of things safely.
Sure, and we know what the tools are. So it's common sense. So first and foremost, again, I go back to vaccinations. Make sure you and your family members are up to date with vaccinations, including boosters. And second, weigh your risk profile. If you're a higher risk individual for developing severe COVID-19, then it's important that you mask in an indoor crowded setting, make sure there's adequate ventilation, social distancing. All the tools that we've deployed successfully during this pandemic come into play.
People who joined us throughout the day yesterday, the governor was talking about this big push to get kids vaccinated. It is something we have talked about quite a bit. Where do we stand with that picture, especially with, school will be here before we know it?
Absolutely. So as per the CDC, if you look at data coming out till mid-July, there are about 600,000 children from 6 months to age 4 years who have received at least the first dose. That leaves more than 16 million children still yet to receive. So it's a little sluggish, to say the least. It's important if you're a parent who has a child that falls in that age group that you talk to your pediatrician, review the data with your pediatrician. These are safe and effective vaccines, and it's important we all make sure that our loved ones are safe.
Why do you think some parents are still on the fence about this? I mean, I have friends who are parents, and they still get queasy about it, some of them.
Unfortunately, during this pandemic, we've noticed there's been a large degree of misinformation and disinformation about vaccines, all these myths, and we in the healthcare arena have worked hard to dispel those misplaced notions. So that's why I always encourage folks, if you do have questions, please reach out to your doctor and have a discussion and make an informed decision.
And I do need to wrap, but a nasal vaccine, you say, is a ways down the road.
It is. It's going to take probably years before we have something credible. It's still in the experimentation stage. The premise is good, that you want to stop the virus in its tracks in the nose. That's the main portal of entry, but we're not there yet.
All right. I'm going to give you an elbow. Thank you for being here, Doctor. As I said, always learn something new when you're here. Nice to have you in studio. Do want to get you over to Rachel Piscatelli, who has been working